You might have heard the phrase, "just do it," when trying to get motivated to begin a physical activity program. However, physical activity without preparation can lead to soreness or injury and might even cause people to quit before they ever really get started. Proper preparation can help make physical activity safe, effective, and enjoyable. Hi, I'm Dr. Steve Ball, an exercise scientist and certified strength and conditioning specialist with the University of Missouri. In this segment of Fitness and Wellness for a Lifetime, I'll cover several topics that you need to understand before becoming more physically active. The first thing to do is to make sure that you're medically ready. The type of medical readiness that you need will depend upon the types of activities that you're going to choose and your own medical history. One way to determine your medical readiness is to take the PAR-Q, the Physical Activity Readiness Questionnaire. An excellent website is located at www.missourifamilies.org, where you can find the PAR-Q in the quizzes section. The PAR-Q is a set of 7 short and basic questions that ask about your medical history and whether you have any signs or symptoms of cardiovascular disease. For example, do you feel chest pain when you're physically active? If you answer no to all 7 of these questions, then you can be reasonably sure that you can start becoming more physically active. Just be sure to start slow and build up gradually. However, if you answer no to all of the questions but you've recently been ill or suffered an injury, it might not be safe to immediately begin any kind of exercise. Also, if you answered yes to 1 or more of the questions, then you should visit with your doctor before you start becoming more physically active. The American College of Sports Medicine, or ACSM, has taken it a step further by developing guidelines and categories for using the PAR-Q. ACSM stratifies or places individuals into 3 general categories based on their age, risk factors for coronary artery disease, and any signs or symptoms of disease. Risk factors include such things as family history of cardiovascular disease, smoking status, high blood pressure, diabetes, obesity, or a sedentary lifestyle. Signs and symptoms of disease are more serious and include such things as chest pain, shortness of breath, dizziness, ankle swelling, a faster heart rate, or unusual fatigue following normal activity. Remember though that these are signs and symptoms, not risk factors. Depending on which category you fit into, the way you determine your medical readiness for physical activity differs. If you're in the low risk category, which means you don't have more than 1 risk factor, you might want to take the PAR-Q. If you're in the moderate risk category, or even if you have 2 or more risk factors, but you answer no to all of the questions on the PAR-Q, then it's probably okay to begin moderate activity. However, if you want to begin more vigorous activity, then you should consider an exercise stress test. The clinical exercise test would allow a physician to monitor your electrocardiogram while on a treadmill to help determine if you have any symptoms or reasons why you couldn't participate in an exercise program. This is especially important if you're just beginning or you haven't been doing relatively moderate to vigorous activity for some period of time. If you have some type of disease or any signs or symptoms of disease, then a medical exam is necessary before you begin any type of exercise program. If you have questions about these guidelines, consult your local fitness expert or the ACSM's Guidelines for Exercise Testing and Prescription book. Like the PAR-Q, even an exercise stress test is not foolproof, but it's a valuable tool that can help determine if a problem might exist. Once you know that you're medically ready, it's also important for you to get the proper equipment, including shoes and clothing. There are many types of shoes now available: running, basketball, aerobic, walking, tennis, and cross trainers. If you're going to do one specific activity, then it might be sensible to purchase shoes particularly designed for that activity. If you're going to do multiple activities, cross trainers may be the way to go. As long as the shoe is appropriate for the types of activities that I've previously mentioned and has a sole with good traction, a well-cushioned heel, an Achilles tendon pad, and a toe box that provides plenty of room, the kinds of things you see on this shoe, then you'll have an appropriate shoe. Also, be sure to purchase your shoes later in the day so that your foot has had time to expand and might even be 1/2 size bigger. And don't keep wearing shoes that are worn out. Inspect them for wear and tear every 300 to 500 miles or about every 6 months. Many times they wear out on the inside before they wear out on the outside. As far as clothing goes, it should fit comfortably, allowing freedom of movement. During hot and humid conditions, avoid nylons and rubberized materials and wear as little clothing as possible. It should be light in color, fairly loose fitting, and lightweight to maximize the evaporation of sweat, which is our main defense against overheating. Once you're medically ready and you have the proper equipment, you need to focus on the components of the workout that you're going to do. In this program, I am mostly going to concentrate on the warm-up and cool-down. The main activity phase of the workout will be covered more thoroughly in a future program. There are many benefits to a warm-up. First of all, it prepares the cardiovascular system for activity. Second, it prepares the metabolic system for activity and gets your body ready to burn calories. Finally, and most importantly, a warm-up prepares the musculoskeletal system by warming up the muscles and increasing muscular elasticity, which can help prevent injury. There are two components of the warm-up, a cardiovascular component and a stretching component. It's important for you to do each of these. In the cardiovascular warm-up, you should do several minutes of walking, slow jogging, bike riding, or some type of slow introduction that gets the cardiovascular system pumping. Research shows that people who do this type of warm-up, even if they have symptoms of heart disease, are less likely to have problems during exercise. When you stretch, you want to make sure you include all of the major muscle groups and stick to static stretching. This sort of flexibility training could be a workout by itself, lasting anywhere from 15 to 30 minutes. However, I don't recommend bouncing or ballistic stretching, especially for beginners. The following stretches can be included into your warm-up for a variety of activities. Of course, if you're going to do something more vigorous like a sport, you might want to add things specific to that sport that will help maximize your performance. The intensity level of the following stretches should only be taken to a point of mild discomfort. Do not go beyond that point. Hold the stretch anywhere from 10 to 30 seconds and repeat it 3 to 4 times. For a lateral head tilt, you should very slowly tilt your head to each side and then hold. Do this several times in order to help stretch the muscles in the neck and the ligaments of the cervical spine. To do a side stretch, stand with your feet shoulder width apart and your hands placed on your hips. Bend your body to one side and hold. And then bend to the other side. This stretches the muscles and ligaments in the trunk and pelvic regions. A body rotation is when you hold your arms slightly away from you and then you rotate the trunk as far as possible and hold. Be sure to switch sides. This stretch works the muscles in the hips, abdominal region, chest, back, neck, shoulders, and spine. A chest stretch can be done with the help of a partner. Simply place your hands on their shoulders while they gently push downward. Anytime you have a partner, make sure to communicate with them about how much they need to assist you. Again, only stretch to the point of mild discomfort. To do a shoulder extension stretch, which involves the shoulders and chest muscles, have your partner grab your arms from behind at the wrists and slowly push upward. Be sure to communicate on how far and hard your partner needs to push. Hold for 10 to 30 seconds, relax, and then repeat. A zipper stretch is also known as a tricep stretch. Place one hand behind your neck and grab the elbow with the opposite hand. Gently and slowly pull downward and backward. This stretch is excellent for stretching the triceps and also involves the shoulder joint. A shoulder rotation stretch is great for the chest, shoulders, and your latissimus dorsi. If you have a stick or a towel, grasp it and bring it over your head, remembering to keep your elbows straight while you hold. Then relax and repeat. For added difficulty, move your hands closer together. In order to stretch the quadricep muscles, most people grasp their ankle and slowly pull backward. This places a stretch on the muscles on the front of their upper leg. However, in this position the knee is hyperflexed, placing strain on it. This position is also risky because instead of bringing the leg straight back, many people inadvertently twist and torque it, which can damage the joint. A safer and better way to stretch the quads is the hip and thigh stretch. Kneel down with one leg in front and press forward with your hips until you feel a stretch in your quads. A shin stretch will target the muscles located on the front of your lower leg. Kneel down on both legs and gradually lean back. This move can also be quite effective at relieving cramps in your shins. To stretch your calf muscles, lean up against a wall and push your heels downward until you feel a stretch. The adductor stretch, whether standing or sitting, stretches the hip adductors or the muscles on the insides of your thighs. Place your hands just above your knees and flex one knee and slowly go downwards. Hold the final position and be sure to switch sides. Another option would be to sit down on the floor, having the soles of your feet touching together. Place your forearms on the inner part of the thigh and push down. To stretch the back of your leg, try the one leg at a time hamstring stretch. This is done with one knee bent and hands behind the back. Place one foot up against the wall and lean into this exercise. The single and double knees to chest stretch requires you to lie flat on the floor, bend one leg up, and then pull your opposite knee towards your chest. This is another stretch for the lower back and hamstrings. You can also try bringing both knees up to your chest. For a great upper and lower back stretch, sit on the floor and place the soles of your feet together as you did for the sitting adductor stretch. Just be sure to position your feet further out from your body. While holding your feet, bend your chest and head towards your feet. A gluteal stretch is done by sitting on the floor and crossing one leg over the other. Clasp your hands underneath the leg that is not crossed, and then gently and slowly pull upward towards your chest. You should feel a stretch in your buttocks and gluteal region. A trunk rotation is a popular one that stretches the sides of the hips and thighs, as well as the lower back and trunk. Sit on the floor with your left leg extended and your right leg bent and crossed over it. Place your left elbow on the outside of your right knee and use it to push back. Simultaneously, attempt to rotate your trunk to the right. It looks complicated, but once you try this one, I promise you'll like it. The cat stretch targets the low back and it strengthens the abs and buttocks muscles. Get on your hands and knees with your hands approximately shoulder width apart. Relax your low back and then arch your entire back by contracting your abs. Think about pulling your stomach in as far as possible. Hold for a few seconds, relax, and then repeat. Remember that for all of these, you should only stretch to a point of mild discomfort. Hold each stretch for 10 to 30 seconds, relax, and then repeat it several times. After you've completed the warm-up, you'll be ready for the main activity phase of the workout. It could be a sport, an aerobic dance routine, weight training, or any number of activities. What's most important is that you choose something you enjoy and can do for a lifetime. During this series, I'll talk more about some ways to make those choices. But basically, you should always keep your limitations in mind and don't do something you're not prepared for. Don't go into a vigorous sport if you haven't been active on a regular basis. It is a good idea to start slowly and be patient with your progress. Once again, I'll talk much more about the main activity in later programs, but for now, let's go on to the cool down. A cool down is basically the transition of the body from a heightened state of activity to a resting state. It immediately follows the main activity phase of the workout. A proper cool down involves gradually decreasing the intensity of the exercise. If you stop exercising abruptly, there will be a diminished return of blood to the heart. This can lead to dizziness, fainting, and even serious heart problems. A proper cool down, such as walking slowly, utilizes what is known as the muscle pump. The contraction and relaxation of the muscles actually help to massage blood back to the heart. In addition to helping return blood to the heart, an active cool down helps remove lactic acid from the blood. Lactic acid, or lactate, is a cause of muscular fatigue and is a metabolic byproduct of vigorous exercise. So a proper cool down facilitates returning your body to its resting state in the safest and fastest manner possible. It's a very important part of the workout, should never be overlooked. Now that you know about the warm-up and cool down, you'll need to know about several environmental factors: heat, cold, pollution, and altitude. Let's start with the dangers of exercising in the heat. There are several incremental stages of heat illness, which if not dealt with immediately, can lead to medical complication and even death. Heat cramps are involuntary muscle spasms that can occur during or following physical exertion. These usually result from an electrolyte imbalance due to excessive loss of salts. Direct pressure, massage, and simple stretching of the cramped muscle should help alleviate the problem. This is the first sign of heat illness and is a signal to drink more water or reduce the intensity of physical exertion. Heat exhaustion is a more serious state of heat illness that usually occurs in a person who is not used to exercising in the heat. This is especially the case if they have not consumed enough water prior to or during their workout. Symptoms include excessive sweating, cold clammy skin, normal or slightly elevated body temperature, paleness, dizziness, weak and rapid pulse, shallow breathing, nausea, and headache. Anyone experiencing these symptoms should immediately stop exercising and get into the shade or an air-conditioned building. An abundant amount of fluid should also be consumed. If the situation seems severe enough, elevate the feet and seek medical attention immediately. The most advanced stage of heat illness is called heat stroke. In simple terms, it is a breakdown of the cooling mechanisms of the body induced by high body temperature. Someone who is experiencing heat stroke may stop sweating altogether and the skin will appear dry and hot. The pulse will usually be strong but very rapid, and the individual may have labored and difficult breathing. Body temperature can sometimes exceed 106 degrees Fahrenheit. Heat stroke is an emergency that requires immediate attention. Remove as much of the victim's clothing as possible and cool them down with complete body submersion in cold or icy water by using ice packs or even a hose. It's very important to seek medical attention as soon as possible. Although air temperature is a key factor in determining your risk for overheating, the humidity level, or water content in the air, is equally important. High humidity levels reduce the evaporation of sweat from the skin. It's the evaporation of sweat that cools the body. So even though it may seem that you're sweating a lot when it's humid, the sweat is mostly rolling off the skin and is really not contributing much to the cooling process. Several football deaths have occurred with air temperatures below 75 degrees, but with humidity levels at 95%. Obviously, the combination of high air temperatures and high humidity levels increases the risk for heat illness to occur. One thing you can do is consult an apparent temperature chart and look for a combination of heat and humidity levels. Most of these charts will indicate both the danger zone and the safe zone. The most effective way to manage heat illness is to prevent it. So recognize that any form of physical exertion, not just exercise, can result in heat-related problems. Realize that unfit individuals are more likely to suffer a heat-related illness. Avoid high temperatures and high humidity levels. Acclimate yourself. As outside temperatures and humidity levels increase, gradually decrease your physical activity in the short term. Then increase your activity back to the previous level over 7 to 10 days. In other words, take it easy for the first several times you're exposed to a hot environment before increasing your intensity levels. Sufficiently hydrate yourself before, during, and after the workout. Be sure to drink more than your thirst is indicating. Monitor your weight before and after physical activity. If you've lost more than 3% of your total body weight prior to the next workout, you should skip the workout entirely. Coaches in particular need to be aware of these guidelines and require their athletes to weigh themselves prior to working out. Dress properly. Expose as much skin as possible to increase the evaporation of sweat. And finally, rest frequently and recognize the early warning signs of heat illness. Cold temperatures and extreme wind chills might actually make it dangerous to exercise outside. So it's always a good idea to consult a wind chill chart to help you decide if you should limit or maybe even cancel your outdoor activity. If you do go out, be sure to put on layers of clothing to help protect, insulate, and ventilate your body. Wearing something on the top of your head will help you retain your body heat, and wearing mittens instead of gloves will help keep your hands warmer. Pollution is an environmental factor that can be a problem in some areas. Consult radio stations or newspapers for reports on pollution levels and check for warnings or advisories. Also, avoid areas where there are a lot of automobiles, since they are a major source of pollution. Of course, an alternative is to exercise indoors where the air is filtered. Finally, altitude needs to be considered in some situations. At high altitudes, the ability of the body to transport oxygen is diminished. Despite this, one can acclimate themselves quite quickly. So be sure to start out gradually and then progressively work up to more vigorous activity. The final aspect of preparation for physical activity is to know the importance of listening to your body. Your body will send pain signals to your brain to tell you something is wrong. Listen to those signals Stop whatever you're doing and figure out what you might be doing wrong, such as lifting too much weight, using bad form, or perhaps you have some type of muscle injury. Sprains and strains are common injuries that usually cause swelling and soreness. Sprains are injuries of the ligaments or the tissues that connect bones to other bones. Strains are injuries of the muscles and tendons. Tendons connect muscles to bones. The Rice Injury Treatment Plan for strains and sprains can help you if you follow it, and if the injury is not causing any structural damage. Don't exercise the body part that is injured, but rest it. Use ice on the sprained or strained area for about 15 to 20 minutes several times a day and elevate it. You might also try immersing it in cold water several times a day. Compress your injured body part with a compression bandage or wrap. And finally, keep it elevated higher than your heart to reduce the swelling. With proper care, rehabilitation time can be reduced. However, if you have any doubt about the degree of injury, then you should consult your physician. I'll be talking more about exercise guidelines in future segments of this series, but for now, just remember to make sure that you're medically ready, have the proper equipment, know the components of a workout, including the importance of a warm-up and cool-down, consider the environmental factors, and always listen to your body. It's also important to know your own limitations, so start off slowly before you progress. And finally, choose an activity that you enjoy and can do for a lifetime.